So what can you tell me about antipsychotics?
Well, they've been developed over the years to treat various mental conditions. Schizophrenia is one of the more common ones. Also, manic depressive. Schizophrenia is where people are responding to either voices or they don't have a total, complete grip on reality, and they have trouble sorting it out, reality and fantasy. And the manic depressive drugs are where, one day you can leap tall buildings and another day you're lower than moss on a rock. And these can be severely disabling conditions. And the drugs were developed in generations, the first and the second generation drugs. And the main drive for developing these drugs is increased effectiveness and decreased side effects. I showed you a list of side effects just with one drug there a while ago. And the first generation drugs, actually Thorazine, it's been around probably 50 or 60 years. And it had a lot of side effects associated with it, but it was given to a lot of patients. And then drugs were developed, analogs were developed of it, and there's a whole list of them that are here. And many of them you do not see anymore. Compazine is a psychotropic drug, but it's also, that's the other thing, many drugs have many different uses. Compazine's used for nausea, vomiting, but it used to be used for psychiatric purposes. Prolixin, Haldol, there's just drug after drug after drug in this first generation of antipsychotics. And then they moved on to the second generation. Second generation means they get more expensive. I mean, a bottle of these, a little bottle of 30 or whatever, ends up, it can cost us basically $800 to $1,000 for 30 tablets. And you're talking about drugs like Zyprexa, Seroquel, Geodon, Cephirus, Invega, Clozaril. Clozaril is an interesting antipsychotic. It's used for schizophrenia, and it has a very serious impact on the white blood cells in some patients. And it's such a serious side effect that the government has registries that we have to be registered with, and we have to see the patient's blood lab values before we dispense the drug.
Wow.
And it's just absolute. I mean, if they don't get the lab value to us, the drug doesn't leave the pharmacy. Or in many cases, they'll take and they'll make them drop back and restart the drug therapy, start titrating up again. So it's a very serious drug. And that's your antipsychotics. And then there's one of the main drugs used for manic depressive is lithium. It's been around a long time. There again, they have to monitor the levels because you can get toxic levels of lithium. So if you're getting that, there again, you have to monitor it. But it's for the manic and depressive type patients. And then there's certain mood altering drugs that came out of the anti-convulsant area. They were originally generated or researched as anticonvulsants for seizures.
Yeah.
And then they said, well, wait a minute, it alters the mood. Let's try it on manic depressives. And so many of them are used for mood adjustments in the patients. And the other medications or the other psychiatric issue, especially in the long-term care realm, is the depression.
Yeah.
People are depressed. What's there to live for? My wife died. My kids have all died. I'm the only one left. I mean, they get a lot of reasons to be depressed in one of those places.
Yeah.
And so they use antidepressants to try to improve their quality of life.
Yeah.
And and there again, the antidepressants, along with all the other psychotropic medications, have cognitive impairment associated with them. They make drowsier. None of these things make you brighter,
more alert.
The only thing that's going to speed you up a little bit is speed or methamphetamine, and that's not allowed in the long-term care setting.
Yeah.
But so those are the and then sleep. People they can't sleep. I mean, they're sitting around all day. There's nothing. If they can exercise, they exercise them. But I mean, somebody who's just sitting there, laying there all day, when it comes time to go to bed, they're not tired, and or if they're depressed, one of the things I call it, and you won't find it in the medical literature, but your mind chasing its tail. You get one little problem, and you just get caught in this loop, and that problem just keeps circling around your brain. You think, "Stop it! I want to go to sleep," and it won't stop.
Yeah.
So those are some of the aspects of the psychiatric medications that you see in the facilities, and then of course during the day to handle their severe anxiety or agitation. They use the products like Xanax, the benzodiazepines, but there's always a push to use less of these drugs to de-emphasize the drug if they can get along without them.